Kat Smith. Thank you again for joining me here at Dr. Kat TV. And as promised, I want to give you information that will help you navigate relationships. And sometimes we have to touch on very difficult topics. Now, as we all know, mental illness has been in the news. And there's a strain on the emotional, physical, and spiritual strength of the loved ones, and it can destroy a relationship. Okay, we want to keep the dialogue going about this topic, and I have shared episodes about hormones and these natural chemicals and how they work in our minds and in our bodies. However, today's guest is going to give us some deeper insight on mental illness, and specifically one focusing on a book that she has written. Her name is Doris King, Doris Denise King. Let me make sure I put her whole name in there. She's a mental health advocate, and she's a certified mental health professional, so a CMHP, that would be the initials behind her name. And she loves to help people recover from bipolar disorder and schizophrenia. She also loves teaching others the importance of hormone balance, and today she lives in Central Florida, and she is here today with us. And hello, Doris.
Hello, Dr. Kat.
Yes, you have been so patient because, I'm navigating the whole technology thing, it's kind of gets crazy. Yeah. So thank you so much for being my guest today.
Thank you for having me.
Okay, well, look, I'm ready to get right into the topic because I know my introduction does not do justice to all the work that you've done. So why don't you kind of elaborate on some of the things that you've done out there and more about what inspired you to get into this area of study?
Okay. What inspired me to write a book about mental health is my own personal dealings with bipolar disorder and recovering using hormone balance. And then I realized that there were other people who were out there who were also suffering. And my desire to connect with those people prompted me to write a book and to start a blog and YouTube channel. All of these things came about so that I could get this information into everyone's hands, because I've been on the other side in terms of being a patient and not knowing what to do when it came to my mental health. And there are lots of people who are suffering, and it's because they don't have access to, they don't have the knowledge about hormone balance for mental health. And so that's what I've been doing since I recovered. I started progesterone back in 2006. So it's been about 12 years now since I started progesterone therapy. And in that entire time, I've been reaching out to others who may also have a hormone-based mental illness.
That's awesome. That's awesome. And it's funny how life takes us to an experience, and it blossoms into something where we can help someone else. And that's my foundation as well. Part of my platform is my survival. So that's awesome that you have taken your experience and you're helping other people to navigate, through these diseases and these, experiences. So thank you so much for the work you do.
Thank you for having me.
This is a touchy subject in a lot of people's mind because they're afraid to come, open up about it and share it with people, because it can be, people can stereotype and they can put you in a box and say that you can't do certain things. So how do you feel from your perspective? How do you feel about being diagnosed?
I understand that there is still very much a stigma and stereotype associated with mental health. And to be honest, I don't know if I would be so vocal about it had I not recovered from it. I never spoke about my mental illness when I was suffering from it because there is such a judgment. And I understand why people don't want to share their mental health status, because it can change everything. It can change your employment. It can change your friendship circle. There is a judgment. There's so much that is unknown about mental illness, and people want to be able to, I don't want to say protect themselves, but you do want to protect yourself. It's already enough to have to deal with the illness. You
Mhm.
don't want to have to deal with people treating you differently.
Exactly.
You just want to just go on with life, you know, as smoothly as you possibly can. So when you when you share that you have a mental illness, then you have to be prepared to deal with the judgments that will come with it, because those are still the times that we're living in now. I'm very comfortable talking about my mental health because I'm on the other side of it. I've lived
Yeah.
with bipolar disorder, but to know that my bipolar disorder was caused by a hormone imbalance, I can speak from the other side of stable emotions now. And some people still judge me, even though I am in recovery. But I'm okay with that. If I'm okay with speaking out, because I know that there are so many people who need to hear my story, and
Yeah,
there are millions of people.
and you're as you are recovering, you're getting better, you're managing everything, and you also you're taking yourself out of your circumstances and putting it out there so that it helps other people, and it's you're not making it about you so much as people think you are. You know what I'm saying? And that
Right.
stigma, people try to make it seem like, oh, she's trying to make it all about her. No,
No.
just like any other person that's trying to recover from something. It took me years to recover from my sexual abuse.
Hmm.
So it's the same thing because of the emotional, mental, and spiritual and physical challenges you go through with recovery. So yeah, I totally get that. I totally get that. Let me ask you a question. How did you discover that you had a hormone imbalance?
I discovered I had a hormone imbalance when I discovered Dr. John Lee's book, Hormone Balance Made Simple. And when I read his book, he was the first doctor that I ever heard that having low progesterone levels was a big deal. I had never heard a doctor give that message before. And just a little bit about my medical history, I was diagnosed with polycystic ovary syndrome when I was 16, and that's the ovulation disorder. And when
Mhm,
you're not ovulating, you're not going to make progesterone. So I knew this. But
mhm.
doctors prior to reading Dr. Lee's book, they told me the only difficulties that I would have is possibly getting pregnant, and I may have to deal with weight gain. But no one ever told me not making enough progesterone could cause me to go insane. I always suspected that my hormones were off, but I never knew how until I read his book. And even though Dr. Lee didn't specifically write his book for bipolar disorder or mental health, he was writing about a hormone imbalance. And when I read his book, I saw myself in the symptoms, and I saw my treatment plan in his pages. And my entire recovery is based off of his 3 rules of hormone balance.
Awesome, awesome. Now, you've also written a book, so tell us
Yes.
about your book.
My book is called Curing Bipolar Disorder and Schizophrenia. And basically what it's doing is taking Dr. Lee's 3 rules of hormone balance and letting everyone know that the information that Dr. Lee shared, this information is relevant to mental health. And I think sometimes in medicine, things get very focused. This doctor is a family doctor. This doctor is an internist. This is a psychiatrist. So a lot of people try to discredit what Dr. Lee was doing because by trade, he was a family doctor.
Okay.
But I've wrote a book to say what the work that this family doctor was doing is relevant to mental health. Everyone needs to pay attention. And I think it's relevant to everybody, even people who don't have a mental health diagnosis. But
Mhm.
I'm just finding that a lot of people have hormonal imbalances. Mine are for genetic reasons, but there are other people who have them because of the diet and the environment. There are so many things that can throw off our hormones. So I feel so strongly about the work that he introduced in his book that I wrote my book.
And at what age were you? I think you said you were diagnosed with your other illness at 16.
Yes,
When did you, after reading the book, how long between then and you discovering that you need to balance your hormones?
great question. I discovered Dr. Lee's book when I was 29 years old. So
Wow.
I was diagnosed with PCOS at 16. I was diagnosed with bipolar disorder at 19 years old. And I did not discover that a hormone imbalance was making me so sick until I was 29. And I'm 41 now. So
You look great, by the way.
thank you. So do you.
Thank you.
So
Yeah. Okay. So let's, for the sake of the viewers, why don't you define for me bipolar disorder and schizophrenia so that they can have a clear understanding of what these two diseases are, because they're not the same. So,
Right. Bipolar disorder is a mental health disorder that is characterized by two extremes, mania and depression. When someone is manic, typical symptoms of mania are feelings of euphoria, poor impulse control, feelings of grandiosity, racing thoughts, pressured speech. All of these things are typical with mania. And on the opposite side of mania is depression, and it's all the symptoms of clinical depression, feelings of guilt, loneliness, uncontrollable sadness, thoughts of suicide, death, and dying. And so when someone has bipolar disorder, they're going back and forth between these two extremes of mania and depression. Some people have weeks of mania and then followed by weeks of depression. There are periods when you don't have symptoms at all. And then there are some people who suffer from mixed symptoms where they have rapid cycling of manic and depressed symptoms in a very short time period.
okay.
And even with bipolar disorder, you can have psychotic features, and that's where you are hallucinating. You can see and hear, feel, taste things that are not there. Usually, schizophrenia is a more debilitating disorder. It is a mental disorder, and mostly everyone with schizophrenia, they have psychotic features, meaning that they are not in reality, and they also hallucinate. This is a standard with schizophrenia. Whereas with bipolar disorder, you may just have the emotional component, but
Mhm.
with schizophrenia, you have the altered reality coupled with the visual and auditory hallucinations.
Okay. And with that, when you're trying to manage a relationship, and in your relationships, you have to manage your emotions, your feelings, you know your mental state. So
Mhm.
how, when you're thinking about how that affects relationships, what was your experience of trying to manage that?
My experience with managing it, actually, I feel that a large part of me not being married or having children is because of my mental health. I knew I didn't want my mental illness to be a burden to anyone. And when I was dating, I was able to hide my illness
Hmm.
because there's a saying where you don the mask. I knew how to kind of pull it together
Yes.
during that hour and a half or whenever I was dating someone. And then I could go back to my room and cry uncontrollably or sleep for hours or deal with anger or anxiety. Whatever I was dealing with, I could, it would come out in my own personal living spaces. But
Yes.
I guess I survived in my relationships because I didn't live with anyone. So I would only go out on dates when I was feeling good or when I wasn't having, symptoms.
Okay.
But
Okay. Well, but let me just to let you know, be transparent. I went through a 6-month bout of depression, and I even thought about suicide. Okay, I had to stop. I mean, I was the office clown during the day, and then when
right,
I got home, I was a sobbing, snotty mess. I just cried myself to sleep, and I stayed inside. I mean, I just, I locked myself off from the world. So I relate to that, and there's a
hmm,
lot of people out there who do relate to that. Okay, and it's just amazing that you took the initiative and the inspiration from God to get out there and find your healing.
yes,
Because sometimes we just sit and think, oh God, and just pray to God, oh please help me, help me, help me, but we're not
right.
doing anything. So the fact that you took the initiative, you got to applaud yourself for that. So
I
that's
thank
really
God.
good. Yeah, that's really good. Okay, so what advice would you give to someone else, aside from just taking that initiative?
Mhm.
What advice would you give to someone who thinks that my moods are just up and down, and people say I'm the term crazy? So what advice or inspiration would you give them that they would take that step and that initiative to get themselves checked out?
Great. The advice that I would give them is to educate themselves about hormone balance. Because right now at this time, hormone balance for mental health is not a conventional treatment. So if you go to your psychiatrist or your family doctor, he or she may not know what you're talking about. So the responsibility of getting healthy is on the patient. And the way that you overcome that and you can move forward and get the help that you need is through education. And if you want to know if your mental health symptoms are linked to a hormone imbalance, I would say to look at your symptoms, because when there is a hormone imbalance, there will be clear and obvious symptoms. The most obvious symptoms are, as women, if you are premenstrual, is to look at your cycle. When your body isn't making enough progesterone, you will have heavy menstrual bleeding. You will have irregular cycles that don't come every month. You will have a history of miscarriage in the first trimester, painful cramping, menstrual migraines, fibroids. All of these things are consistent with low progesterone. And then on top of that, fibrocystic breast, anxiety, all of these things, if you look at your symptoms, what we're seeing when we see mental illness, we're actually seeing what it looks like to have a progesterone deficiency and let it go and treat it for several years. We have the physical manifestation of it. But I just feel that medicine has overlooked it for so long because progesterone has been deemed as the female pregnancy hormone. But that's just one of its roles.
Yes.
Progesterone is also needed for our brains. It builds the myelin sheath. It keeps those neurotransmitter systems in balance. Everything that's out of whack in mental illness, progesterone works together with estrogen in our brains to make sure that everything is working as it should. And that's that's my advice to anyone who has a mental illness, is to look at your hormones, look at the hormones of people who are in your family, because when there is an imbalance, you will see symptoms. You will see clear symptoms, and you will feel confident as you move forward with treatment.
Yes. And that's so important because, what a lot of women don't realize that we have testosterone, estrogen, and progesterone.
Absolutely.
And, yeah. And you know what I also noticed is men will go and have their hormones checked quicker than a woman. Because
Oh,
first of
wow.
all, they know it affects their sex, their libido.
Right.
So they're gonna for
So
sure
they're
get
gone.
that checked. But women, we don't understand that, and I suffered from fibroids, so I was able to get myself checked, but I didn't just, I was like, you're not taking my guts, I'm going to keep my guts, I
Exactly.
want my woman parts.
Exactly.
But there's other options. You don't have to have a full hysterectomy. You can have an
Don't.
ablation. There's other options out there. Don't just have your doctor say, "Oh, this is what we got to, open you up, take your stuff," and then,
Right.
then you're not going to be producing those hormones like you should.
Right.
So, check with your doctor, get a second opinion,
Absolutely.
educate yourself on
Absolutely.
hormone balance. So, yeah, so I have really not only learned a lot from you today, but I really enjoyed our conversation. You are so knowledgeable in this area, and I'm so glad you were able to share this information with my audience. Tell me, where can they find your book?
They can find my book on Amazon.com. It's available through Amazon. And also I'm available on YouTube. You can search for Mental Health Doris.
Good.
And that's where you can find me.
Okay, and I'll make sure I have those links all in the scrolling as we're going along. That technical stuff, I have to let them handle that. But
I understand.
Yeah, but we'll make sure we get that information. We'll have it below the video and everything, so anybody can just look below and check her out.
Thank you, Dr. Kat.
Connect with her on her social media, and share this information with someone you think that may be able to use it.
Yes.
Send the link to this video to someone else so that they can get this information. Okay. So Doris, again, thank you so much, and we'll talk to you guys next time.
Bye. Thank you.